Okay, so I am sharing the scenario and I will be giving you 3 minutes and you can just go through that. I'm sharing a presentation.
Okay, is this history taking or video presentation?
Oh, it's a communication station.
Communication.
Yes.
Okay, okay.
Yeah, it's you know that we are going to discuss the congenital hypothyroidism, right?
Yeah, I know, I know. Yeah,
Yeah, it's based on that. So don't worry.
okay.
Oh, okay. So are you guys able to see the scenario, everyone?
It's a little bit small picture. Anyway, I can read it.
Okay, I am sending a picture of the scenario in the Telegram group as well. Okay,
Okay.
and you can also read it from there. Just a second. Let me know if you want to start it earlier.
Okay. I can start now, Dr. Iqra.
Yes, just let me start the timer.
Okay. I have put the timer. Shall I start?
No, just give me a second. I'm
Ah, okay,
just
that's fine then. Okay.
just okay. Your time has started.
Okay. Hi, Mrs. Sarah and Mr. John. Hi, Mrs. Uh, and Mr. John. I am Dr. Jeevantika, one of the doctors in this unit. First of all, congratulations. You have become mom and dad now. So, how are you today?
Yeah, doctor, I'm good. Thank you.
Yeah, nice to hear that. I know uh, Adam has got some concerns because we have some test results. GP has informed us. So, do you know about that?
Yeah, doctor, I don't know. We just got a call from our GP yesterday, and he said
Yeah.
that a baby test that was being done. They have some issue. They said they have something wrong about his test, and it's related to the thyroid. And they said that they'll be referring to you, and you're going to explain that what exactly is this and what's going to happen now. I'm just really worried about my child.
Yeah, I can really understand your concern because this is your first child, and still you are, I think, you are in healing process after giving birth, so that must be very difficult for you. And if you want anything, you can
Yeah,
ask me, and I will explain some things to you whenever you want. And if you are feel
yeah,
comfortable,
please
please let
explain. I
me
mean,
know.
what exactly?
Yes,
Yeah, what
I
exactly
have
is the issue?
Adam results because initially we do thyroxine check of every baby, but uh, Adam's thyroxine hormone level has been increased, and this is sometimes we have a greater concern about this. So, are you okay if I explain a little bit more, or you have any question?
Yeah, please explain it.
Yeah, thank you so much for your understanding. And actual thyroxine is hormone. We need it to every mechanisms in our body. It is a major hormone that affect our body functions for and our
So you're
day-to-day
telling me that
activities.
my baby is not making the hormone? I mean, I'm not really sure what a hormone is, doctor.
Yeah, hormone is some chemical that always we need to do every function. I mean, thyroxine is hormone. It's a chemical, and we need to do
Okay.
every function in our body. So sometimes we are lacking of anybody can lack of thyroxine, but especially we concern about a baby who has this increased thyroxine producing hormone level because
But
usually
doctor,
we
I mean, how did this happen? I mean, why did this happen to my child? Is there
yeah.
something really wrong?
No, it's not really wrong because we see this is sometimes common problem among neonates. But luckily we have diagnosed this one. So
So
because it has treatment.
this is a temporary issue, right? He's going to get okay. I mean, you're not gonna give some medicine and this is gonna get okay.
Uh, the thing is, we need to find the cause for that. Now, just we have found out that thyroxine producing hormone level is increased. This can be due to actually usually it's not the other might not have his thyroid gland, or this could be another problem in brain. I mean, it's there is a gland called pituitary, so sometimes it doesn't
Oh,
produce much
this is a
thyroxine.
lot, doctor. I don't know. You're talking so much. He has issue in his brain as well. I mean, he's just a child, and you're telling me that he has so many issues. Oh, my poor child. What's gonna happen to him?
I'm
I don't
really sorry
understand
to
what
hear
you're
that, but
saying.
yeah, I know I'm giving much details, but the thing is, this thing is we can treat and it's fully treatable, and you don't have to worry about that. The thing is, we can do some scan of the leg to find out whether Adam has
So,
got
how are you gonna
thyroxine.
treat it? How are you going to treat it?
We have drugs called because this hormone we can give through a tablet, and
Okay, tablet
then
to a 10 days old baby? How am I gonna do that, doctor? What are you saying?
really, yeah, I can understand you, Mrs. Don't please don't worry about that because
No, I
I
am
know.
worried, doctor. How can you say that not worry? I mean, I am worried. It's my child. You're telling me that he has some
Yeah, because we have some specific, we
issue
give a
with
dose.
brain as well.
No, I mean, it's a rare cause. Still, we will look for that, but most of time, babies can have temporary this thyroxine level
Doctor,
up.
just tell me that how are you going to treat my child and how early is he gonna get better? Please just tell me that.
Yeah, Mr. John, because if we found out that Adam has not thyroid gland in his neck, thyroid gland is situated in the neck of our
Oh, I don't
body.
know, doctor. I'm not a doctor. How would
Yeah,
I know?
yeah, I know. that then we will find out whether it is not there. Then we will start treatment because
Okay,
as I said
you have left
earlier,
with three. You are left with 3 minutes. Okay. Yeah.
okay. So as I tell you earlier, we have treatment, and the thing is with this
So how long
treatment,
is the treatment, doctor? Please, just right now, I don't feel like understanding what thyroid is and what all. I just want the treatment for my child. Just tell me what is the treatment, how long is the treatment, and is my child going to be okay?
the thing is if this is not thyroid gland in your body, then we have to definitely continue thyroxine whole throughout whole the life. But good
Oh
thing
my,
is,
what whole life? You're telling me that my baby has a condition for which he needs medicine for whole life? How,
yeah, I can
doctor? How is this
understand.
going to? Oh my
But
God,
the
this
thing
is so
is,
upsetting, doctor. I'm so upset.
yeah, really sorry. I can understand you, but don't worry. We will look
Doctor,
into first
you're just
cause.
telling me, don't worry, don't worry. How can I not worry?
Yeah, but we will help you to get through this, and we will give more explain. So if you are not happy, I can arrange a
Can this report be
discussion.
wrong? Can this report be wrong? I mean, can there be a chance that my child does not have that?
Sorry, I didn't get you.
Yeah, I mean, can this report be wrong? Can it be possible that my child does not have this and the report is wrong?
Yeah, we will definitely repeat this one. And but basically, this level shows more than 20, so we are concerned about that. And first, we will start thyroxine, then we will do the necessary investigations. And if you actually, I will provide
Doctor, so
some
you tell me that
leaflets.
it's a tablet. How am I going to give a tablet to a 10 days old baby?
No, it's not giving tablets. We will give you the crush appropriate dose to your Adam. So it's easy
Okay.
to give with the milk. Yeah, and we will provide all the details, and I will provide some leaflets and arrange a meeting with a consultant if you want. Are you okay with that?
Yeah, doctor, I don't know. This is a lot that you have told me, and
Yeah,
I'm so
definitely.
upset. I mean, it's just my
Yeah.
little child, and I don't know how am I going to tell it to my wife. She's already going through a hard time after birth, and now this thing is happening. I don't know. This is so upsetting.
Oh, yeah, I can understand, but we will help you and we will further discuss this if you are happy with that. I know this is much information to you.
Yeah, this
Are
is
you
a
okay
lot.
with that? Yeah.
No, I need more clarity in all of this. I hardly understood what you said. I mean, there's a disease, but I need
It's
more
okay.
information. I need to talk to someone else.
Yeah, it's okay. I will definitely arrange a discussion with consultant and provide further details to you. And I will give some leaflets and websites
Okay,
so
your
you can
time's
go
up.
through them. Yeah, thank you for having conversation with me.
Yeah, thank you, doctor. Thank you. Okay, okay, everyone. So, does anyone want to have any? Okay, right. That's it's really good. We have a lot of participants here. It's almost more than 40 participants. Um, Good evening, everyone. Good to have you all here. And we were just having a communication scenario. And Dr. Jivantika, good job. But we need to discuss a lot of things. So before I start, I want you to tell what do you think went well and what did not go well in this scenario.
Actually, this is the first case I do after many months. So,
Okay.
yeah, I'm okay with that because sometimes I feel like I was not ready for the communication scenario.
Yeah, that's fine.
So,
That's fine. I mean, we're
yeah,
not here to judge anyone, and we're not here. So brave of you to just volunteer and come up. And this is basically the first step in your learning. I mean, this is going to help you. So
yeah,
what do you think
definitely.
was the main issue that you faced?
Uh,
Okay, okay. Let's
maybe
just start. Okay, I'll
yeah,
just start
okay,
with yeah.
okay.
Okay, so first issue, what I think, okay, actually, we have a lot of participants, and if we start discussing, allowing everyone to talk, maybe that could get a bit difficult. So we'll have questions from all of you. First, let me give you a briefing of how it went. So the first thing was that always take proper time when you are given time. I always say this in my communication scenario classes, and I always say that in my teaching sessions as well, that reading the scenario and making a proper concept of that scenario in your mind is very important. Okay. So what time you get, most of you probably know that you get 3 minutes, or it's basically 4 minutes, but here in the practice we give 3 minutes. So imagine that you have got 3 minutes outside in which there is a big scenario, it's a big paragraph. I mean, I did give you a proper scenario. It was of, I mean, almost 8 to 9 lines. In the exam, same thing happens. You might get a scenario which is even bigger than this one, and it's not necessary that you get the exact diagnosis. I mean, just like in this one, you did not get a proper full diagnosis. In this one, you were given a lab value. Same thing happened in one of the scenarios in the recent exam, where there was the scenario was of coarctation of aorta, but it was not written simply that the baby has coarctation of aorta. The blood pressure readings were given, and according to that, you had to make a diagnosis yourself. In this scenario as well, I gave you the values that TSH levels are more than 20, right? Throughout the scenario, you were confusing the thyroxine with the TSH levels, because at times I thought that you said that thyroxine levels are high, the thyroid hormone levels are high, but basically it was TSH that was high. So you did not have to tell that which level was high. That created a confusion. At time there was a point in the discussion where I thought that you might have confused the scenario to be hypothyroidism, because you said that the thyroxine hormone, that is basically high in the body. Okay, so first thing first, that you need to read the scenario very carefully, as many times as you can. Read through it once properly, mark the lines, because you can't mark the lines, but you can write the important information. You do have a pencil and a paper with you outside, so you can just write down the important things and just analyze the data what has been given and make a proper diagnosis in your mind that this is this. So you see in the guidelines it is given that if the TSH levels are more than 20, that is a confirmatory it's kind of confirmatory that the baby has hypothyroidism, right? If the values are between 8 to 20, then you have to repeat the test. And if it is below 8, then obviously it's a different case. So in this scenario, I gave you the scenario where the levels were above 20, which was a clear cut. It's a positive test, right? Less than 8 is a negative test. More than 20 is a positive test. We do confirm it by checking the free free T4 levels in the body as well, because obviously you have to check them as well. But this is a screening test. So thyroxine is one of the most important hormones in the body that has to work, that work to overall make the functioning of the baby better, proper growth better, everything. So you have to start the thyroxine, so that you picked well. The other thing was that you have to read that whom are you talking to. Your first sentence in which you confuse the names, it kind of just um it kind of just lost the connection between you and the role player, and it failed to make that impression. So always write down the name. That right. What I did in the scenario was that in the beginning I write that Mr. and Mrs. John have been blessed with the baby Adam. Okay, and in the task I wrote that talk to Mr. John. So you were not talking to two people at once. You were talking to Mr. John, right? I think you confused that as well, because you were discussing the part of the giving birth in making the repo as well, right? So always read the scenario very carefully. First thing first, write down the name of the parent and the baby, and make sure that who are you talking to. At times what happens is that you confuse the name of the parents and the baby, and they kind of get intermixed as well, so that causes a confusion. So this is a very serious thing that they take notice of in the communication station. So that is one very basic thing of how you make things work outside, what you have to do outside, and how you can make that. After that, once you enter, so can anyone, okay, when you tell me, sorry, Dr. Javantika, so what are the steps that you do when you go and start the communication scenario? First one is the introduction. Okay.
Yeah.
So you introduce yourself, right? What else you do after that?
Usually confirm their names and
Right. Okay.
yeah, and then yeah, build up the
And
rapport.
congratulating them for the baby.
Yeah, right. Repo, the basic, the repo building. You can do it anyway, especially in these cases when you have a newborn baby. It's always good to congratulate it. Yes, you did
Yeah,
congratulate that. Yeah, you
and then
worked on the repo as well when you said that you. Okay, yeah. Someone is saying making repo clarify your role. Yeah, good job. That's right. You did make the repo, but in repo, what you missed was that probably you said that giving birth is difficult. Uh, you were talking to Mr. John, the father of child. So you were supposed to make a repo like, I hope your wife is doing
yeah,
well after the birth, something
of
like
course.
that. Okay, yeah. Okay. So okay, so clarify your role. That's right. Clarify your role means okay, how would you do it again if I ask you? How would you make a line of clarifying your role?
Then I would say I'm Dr. Jivantika, one of the pediatric doctors.
Right?
Uh,
Okay, your clarifying role means your task. You have to tell them your task. Like in this one, I'm here
okay,
to talk to you about Adam's health, or I'm here to talk to you about Adam and answer any of the questions that you have. So, whatever is your task, you have to clarify that. It might be that you have to tell him, okay, don't use very serious words that I have to talk to you about the condition of Adam, or maybe something like that, because at times the parents can get apprehensive on that. So, you can just simply say that I'm here to talk to you about. Adam and clarify any of the concerns that you have, right?
okay,
In
yeah,
some cases, you may when you might have to get a consent for something, you can discuss about that. Okay, so next, someone wrote that yes, explore the knowledge of the parents, right? So after clarifying the role, you just tell that what do you know about the condition of the child, or what's your update about Adam? So you said that yeah, the GP has informed that certain test has been done. So what's your update about that? So yes, you asked about that, and I told you that yes, the GP has told us there's something wrong about. Sorry, is someone saying anything? Okay, I think that was okay, so explore the knowledge of the parents. Explore the knowledge of the parents is in two ways, right? Once is that what's your update about Adam? Yeah, or you can say that the GP has sent us a referral, and there have been certain tests done about regarding Adam. So what's your update about that? So okay, the parent would tell you that that's yes, the test has been come and they've said that he has some issues. Uh, After that, is someone saying anything? I think everyone, please just hold your mics because that creates a bit of a trouble. Okay, after getting that knowledge, you always have to ask about the attendant, right? Do you want someone else to be here? Because, I did say in the scenario that both of the parents, but you were just talking to one of the parent. So always ask, do you want someone else to be here with us today, or do you want me to start? Right? So always ask about that. There are the very few cases where very few scenarios in which you don't do that, but usually you have to do that. Okay. After that, you'll say that the reports of the Adam have come positive, and they have come positive for a disease that we call hypothyroidism. You have to take the name of the disease that you have identified, right? You simply started telling me that there's some hormone in his body that is increased or decreased and something like that. You always have to, because in this practice, you have to tell the parent what the disease is of the child. Okay, so you
okay,
have to tell
yeah,
that he has got a disease. We are suspecting that he has got a disease which we call congenital hypothyroidism. Do you have any idea what that is? Okay, so that is the second time you're checking the knowledge. First time the knowledge was about the
yeah,
baby, and second time is it's about the knowledge. The parent might know that about hypothyroidism. He might know that someone in the family has that, or any information. That's up to the role player, that how much has he explained. So you have to tell that, ask about that. Do you know about that particular condition? Okay, so when they tell yes or no, or whatever their response is, you might have you could have helped by drawing a diagram. You could have drawn a neck and maybe drawn the thyroid gland over there, right?
Yeah,
And
sure.
you could have said that there's this gland in the body and this produces certain, you first, now you, whenever you're telling a diagnosis or something, that you have to treat that parent as a layman. He does not know a lot of things. Jargons, using jargons is not allowed, which you used quite a lot during this discussion. Hormone is a word that is not, that's a common word to us, but it's not a common word to the parents. So that's when I asked about that, then you told me that it's a chemical substance. But you need to make a proper sentence about that. And what if I tell you that probably you should have started discussing about making a picture of a neck, maybe, and then
Yeah.
drawing a thyroid gland, that this is a gland in the body which has a certain role. It releases certain substances in the body, which is called thyroid hormone. And that thyroid hormone is really important for the growth and uh, proper growth and proper growing up of the child, and his it's important for his health because it has a lot of functions in the body. What's wrong in the test of the Adam is that we're suspecting that this gland is not that this the either the gland is not there, or there is not enough thyroxine, the thyroid hormone in the body, due to which he might be at the risk of not growing properly. Okay, I'll just start. I'll just see that what people are writing. One person has written only father is present, mother is not present in the discussion. Okay, yeah, that's what we talked about. Hormone, yeah, you can say the chemical substance produced by the gland for the function of growth and intellect in the future. That's right as well. So basically, you have to tell about the gland. You have to tell about the that what the thyroid hormone is. Maybe you can tell one of the two functions of that as well. Now when when the child, the father asks that why did this happen, so there can be a lot of causes for that. It might be due to that the gland is not okay. By the end of the talk, you were just kind of consistent that the thyroid gland is not present. This something of like
Yeah.
this was not mentioned in the scenario, because there cannot be, that most of the cases of the congenital hypothyroidism that are not because of the absence of the gland, most of them are because the gland is not proper, or proper synthesis is not present there. The gland is present there, but it's not functioning properly. So you cannot give such statements which are not present in the scenario. Okay, so
Okay.
the the sequence of telling things was about the gland, about what the hormone is, the chemical substance is, what its function is, and this is not present. Okay, right. Then give some time to the parent. You kept your sentence repeatedly was "Do not worry." That doesn't sound a very very good scenario to comfort a parent who has been given a diagnosis of a child who has just got a diagnosis and he's worried about that. You can use some alternate sentences. Every one of you, this is for everyone. Make 3 or 4 consolation sentences or just comforting sentences that you are going to practice, and you are going to use them in your scenarios, because it could have been said in a better way, like, I can understand that you're really worried, but let me tell you that we are here for you and we are here for the baby. The good thing about this is that we have found that what's the issue, and the other good thing is that we have the treatment for that. We have a lot of kids around us that have such disease, and when the proper treatment is given, they live near normal life and they're going to school, they're doing everything better. So I can understand that you're really worried and concerned, but let me tell you that this is a treatable thing. How you take the scenario, that is how you answer the concerns of a worried parent, that yes, you do understand. I understand that you're really worried right now. I understand that this is a lot for you to digest. This is difficult for you, all of this to understand. So let me just be very simple and clear about my things. Said we have got this diagnosis and this is how we are going to further proceed. If you have gone through the Yeah, okay. So there's a one question that what if my baby needs further test? Yeah. You see, if you go through the guidelines, it says that you do start the thyroxine but you do have to go for certain other tests, which includes the um, T4 levels, some other, you can, but you don't have to tell exactly what test, you just can guess. We are going to do some other blood tests. We are also going to do, we might also have to do some jelly scan of the neck and to see that if the gland is properly present, and some other tests to see the proper functioning of the gland as well. Because you see in the guidelines it is said that you have to send the 3 4 levels, and you see that what the range of the levels is. Then you have to see the radio, you have to do the radionuclide scan as well, and you can have to do the ultrasound scan as well. There are different timelines for these things, so you have to go according to that. After that, of telling about the diagnosis, telling about the treatment, now comes the part that you have to tell about how you are going to give. Because you see that, I mean, parent may ask that why are you not giving a syrup to the child? How is he going to take a tablet? So you do tell that yes, you're going to give a proper crash tablet, but you have to tell it. You have to tell the importance of that, because this is basically something which is really really important. You can't just be unclear about that it has to be given daily, properly mixed. How, if the parent is asking in detail, you did say that yes, we'll be guiding you out that. If you have a little amount of time, you can say that yes, we'll be guiding you out that. But you need to be clear in your mind that how do we give the tablets, and it is not to be mixed in the formula milk, and this is really important. And if the child vomits out after that, you have to repeat the dose as well. After that, for what's the further step is that you have to do the other screening of the child as well. You have to do a detailed examination of the child, because if the parent may be asked for how long the treatment will continue, yes, the treatment is going to continue for life, as the doctor said, because you see, it's a lifelong condition, but that depends on the further follow up as well. In the guidelines, it is said that you have to follow up the baby very frequently. It's written that you have to follow up the baby at 2 weeks, 4 weeks, 8 weeks, 3 months, and then 6 months, 9 months, 1 year. This is the proper, and you have to tell them that you're going to come for the follow up, and on every follow up, you're going to do the weight of the child, the height of the child, the head circumference of the child. You have to assess the development, and you have to check the blood samples as well. So you have to tell about the follow up as well. Other questions that could have come in this as well, that can my other child, because that time didn't come, or otherwise it would have come, because whenever a congenital disease is diagnosed in a baby, the parents are concerned that is my other child going to have that. So you need to answer that as well, that we cannot confirm that right now, but we can discuss it with the seniors and maybe let you know. And some other questions can be that how can we have prevented it, and can my child have other problems as well. So there's a little more chance of the kids who are having congenital hypothyroidism. 10%, there's a 10% chance of having them of other diseases like congenital heart disease. So you have to tell that yes, we'll be doing a heart scan for the heart, ultrasound or jelly scan for the heart as well, because that can be associated with that as well. All of this, you don't have to tell all of this. In this scenarios, when there is kind of a breaking bad news and information giving scenario, it was a mix of both. It wasn't really a breaking bad scenario because the parents already knew about the test results. It was more of a patient, it was more of information giving kind of scenario. So in that kind of scenarios, you have to keep on answering the questions of the parent. Whatever he asks, you have to answer them. Try to answer them in a simple, clear, brief manner, and then just move on to the next question. What happens is that if you're not really satisfying the role player, the parent, they will keep on asking the same questions as well. Okay, so let me answer a few questions. Can we tell about the rare syndrome? Can we tell about the rare syndrome baby can possibly have a too much? Okay, if the parent is asking himself that what else are you going to do, you can tell that yes, we are going to do a detailed examination of the child, because children who have congenital hypothyroidism, they might have something wrong with the heart. So we are going to do that as well. But you don't have to put on necessarily if the mother is already worried, the parent is already worried. What if mother says lab reports may have an error? Okay, so in this case, you have to say that that is less likely to happen, that the reports have error, but we're going to run the tests for the further confirmation as well, because this was a screening test, and for the confirmation we are going to do other blood tests as well. But since this hormone is really important for the child, we are going to put him on the treatment, and if we'll just confirm it with the further blood tests. If the parent asks, is it confirmed that the baby has this condition, then what will be the answer? Okay, so you say that in such what we told about this, yes, the screening means that there's a high suspicion that the child has that. Okay, for the confirmation, we are going to do this further blood test, but this is a condition which needs immediate treatment. So we are not going to wait till there is confirmatory test results come. We are going to start treatment for the child. How can I prevent in my next child? So what happened is that if you have read the guidelines, it says that the samples from the mothers are taken as well to check that if the mother is having any thyroid condition, which might be the cause of this in the child. So if in you don't have to say that you can say that yes, we'll be doing some tests on the mother as well, and we'll be discussing about this with a consultant doctor and see that what can be done about that, because there's not a confirmatory answer to that. It can be obviously sporadic and you cannot just really predict that. um okay, so this is probably most of the things that is from my side. What about lab error? Okay, yeah, we have discussed that lab error. It's very less likely, because you see that what's the words written in the guideline is that if the level is above 20, it is positive result, it is suspected, and there's a high probability that he is going to have that. So that is going to get confirmed when you are going to send the free T3/4 level and the TSH levels in the blood. If the mother said it's lifelong, then how to counsel? Yes, you have to tell that, yes, I understand that this is a really difficult thing for you. But you see, you have to tell them that the good thing is that it is going to be treated only by giving medication. And as long as the child is taking the medication, he will be living all a near normal life. He'll be going to normal school, and all of his development and brain development and the body development is going to go normally. So that's how you tell it to them. So this is a lot from me. I think if during monitoring TFTs has normalized, can we stop the medications? Okay, so if you see that the TFTs are being normalized because you are giving the medication. You have to keep make one thing, the one concept clear, that you have to give the dose in certain level, that the T4 is at a higher level. Okay, you have to keep T4 in the higher normal range so that the TSH is in the normal range. What happens is that if you're not giving a proper dose of thyroxine, you see a report, it's you can go through the guidelines as well. I'm just explaining the concept to you, that why are we giving the T4 level? We want the T4 levels in the upper higher, so that the body does not have to produce a lot of TSH to compensate for anything. If you're not giving the proper dose of thyroxine, so if the T4 levels are in roughly the normal range, but the TSH levels are really high, it means that you're not giving the enough dose of the thyroxine. The body has to compensate, and the body is producing high levels of the TSH to compensate for just the normal levels of the T4. Okay, so keep this in mind, that what levels have to maintain, you have to maintain the higher value, the high upper normal range of the T4, and the TSH is to be in the normal range. So when you have the good T4 levels, they are going to go to the peripheral receptors, and the T4 is going to get converted into the T3 and work there, and the child is going to develop normally. Could it be transient hypothyroidism? Yes, there can be a chance that it's a transient hypothyroidism, but even in that, the case of the transient hypothyroidism, you have to start the thyroxine. You cannot wait for that to just get normal. That is going to maybe get in the future, in the further testing, it can get clear, but you do not just wait that it might get approved. You just start the thyroxine, follow up the child, and in the future, after properly analyzing the thyroid functions, you can decide about that. Okay, and obviously it's written that you have to properly record that when the treatment has started. You have to provide the parents with a 28-day prescription of the thyroxine, and properly guide them and refer them to the GP. Okay, so Dr. Jivantika, thank you. It was really good of you. I'm really grateful that you volunteered, because without a volunteer, the session does not really go well. So if any one of you have any other questions or any comments, I would be highly happy if you share any of your comments or anything.
Thank you, Dr. Iqra, giving me the chance. This is after a long time, long
You're
time.
always
So,
welcome. You are now. I expect that you are going to participate in the Telegram group as well, and going to send
yes,
your responses, because that's going to improve your speaking and everything much more.
yeah, thank you so much. Thank you.
Yeah. Any response or any comments from anyone else? Yeah. Thank you so much, everyone, for joining. I hope that it was helpful. Okay. If asked that after doing further tests, everything is normal, then what about the side effect of the drug? Okay. So, that's uh the thing is that when the treatment is started, the thyroid levels obviously are low. So this is not going to be, you are going there's a deficiency present which has been detected on the test, so you are covering for that deficiency. I don't think the scenario is going to get to that level, that if it's transient and if it's given, I don't think that's going to happen at that very stage. But the guideline says that even if it's transient, you have to start the medication. You have to be just clear about that. You don't have to go into the a lot of like a lot of confusion in this one. Yeah, we are here to guide you about all of the clinical exams. Regarding the part one, yes, we can guide you about that. We have groups for that as well. We have this Telegram group for the clinicals, and for everyone who does not know, I daily share a task on the Telegram group, and I expect you guys to give me some responses on that. You can give me a written response, or you can give me a voice note, and I listen to that. I check all of your responses, and I will correct you on the group as well. So don't be shy. And regarding these live sessions, we usually have them once a week. So you guys can even suggest topics that what you want to discuss in our live sessions, and any other topics that you want to discuss in the group as well. So we're here to guide you, and I'm glad that you could be of help. Okay, Telegram group link. Yeah, I think admin can, if anyone from the admin can share the Telegram group link here. Okay, let me just see if I can share the. Till then, if anyone wants to, yes, regarding endocrine cases, yes, we can definitely discuss about the endocrine cases. Uh, Currently, what my aim was that we are discussing the guidelines, neonatal guidelines, because that's something which gets neglected. So, for the last 10 days, almost probably 2 weeks, we are discussing the important guidelines from the neonatal ones. And once we're done with that, we'll move to the further topics of the endocrine as well. Okay, so if no one has any other question, I think I've shared the link in the group chat. I hope you can join, or we have a WhatsApp group as well. We'll share the link in the WhatsApp group. You can join it from there as well. Anyone who's having Telegram issues, they can download the VPN and they can join through VPN. And thank you so much, everyone, for joining in. I'm really glad to see all of the response. I'm really glad to see that a lot of you came up and joined. And I hope that with all of your support, we are going to have further sessions as well. So thank you so much. Signing off for today. Have a good night and keep participating in the Telegram group. Bye bye.